Hi, I am Lilica Sanca, biologist from Bandin project, a center for research in Bissau, Guinea-Bissau. I'm going to present a study about birth, impact of birth immunization on immature-to-total neutrophil ratio on the first day of life. Early onset neonatal sepsis is a leading cause of newborn death in developing countries. Some studies have reported that it is the most common cause of neonatal mortality and was responsible for over than 30% of neonatal deaths each year in developing countries. However, this estimation may not be very accurate since it may be difficult to differentiate sepsis from other conditions because the clinical signs are not specific. To identify children with early onset sepsis, a simple diagnostic test could be of value, and hematological response to inflammation in neonates is including many changes in the form of an abnormal total count cells. For example, immature cells from the bone marrow may be present in the bloodstream. The immature-to-total neutrophil ratio can be determined by using a simple procedure that requires minimal equipment and can be easily employed in low-resource settings where more advanced diagnostics like blood culture are not available. While a high immature-to-total ratio is sensitive to identify early onset sepsis, the specificity is poor because there is other factors aside from bloodstream infections that cause an elevated immature-to-total ratio. Newborns are vaccinated with live attenuated Bacillus calmette-guerin vaccine, which can be viewed as an infection by the infant immune system and does increase immature-to-total ratio. This study evaluates whether birth immunization with BCG has an effect on immature-to-total ratio 24 hours after vaccination. It has not been evaluated whether birth immunization affects the immature-to-total ratio. This could contribute to the low specificity of this test. A better understanding of these factors can help also to eliminate false positives and thus reduce unnecessary treatment to the newborns that are not sick. Our main objective is to determine if at birth immunization with BCG and OPV is associated with an altered immature-to-total ratio in the newborn. This study is part of a randomized controlled trial evaluating the effect of immunizing with BCG and OPV vaccines at birth or hospital discharge on hospital mortality. The study is enrolling newborns admitted to the nursery at Hospital National Simon Mendes in Bissau, Guinea-Bissau, a small West African country. One day after randomization, when only half of participants have received the vaccines, a blood sample is taken from each newborn to assess immune changes due to BCG and OPV immunization. Newborns are followed up daily in hospital for survival, growth, and vital signs. After randomization, a blood sample is collected from each included infant via heel prick, which is followed by smearing onto a blood slide. The slides are fixed and stained on the same day with the sample collection. And later it will be analyzed microscopically for differential white blood count cell with specific focus on neutrophil granulocyte count. The neutrophils are fairly uniform in size with a diameter between 9 and 15 micrometers. The nucleus consists of 2 to 5 lobes joined together by hair-like filaments. The effects of BCG and OPV on immature-to-total ratio, determined by microscopy on immunized infants, was compared with those immunized using the Mean-Whitney U test in Stata statistical software. Within 124 children randomized, 64 was vaccinated and sampling was made 24 hours after vaccination, and 64 was unvaccinated before sampling, and they will be vaccinated on hospital discharge. The baseline characteristics were similar in terms of sex and mother's weight. However, we observed attendance for more twins and lower birth weight in the vaccinated group. The mean number of immature neutrophils was 8.2 and total neutrophil was 55.9 in the vaccinated group and 8.1 to 55.9 respectively in the unvaccinated group. The mean immature-to-total ratio of neutrophil count was 0.14 in the vaccinated and 0.15 in unvaccinated group, and so did not differ between the two groups. The major problem in neonatal infection is not to identify infected infants, but also to identify not infected infants. Early as well as correct diagnosis is a difficult task but can be made. While the immature-to-total ratio is an excellent test to identify infection, the specificity of this test can make difficult the correct diagnosis, and the reasons are not known. Our study revealed that while vaccination with a live vaccine can behave like a live infection, BCG vaccination does not affect immature-to-total ratio 24 hours after randomization. The caveat to our study is the capillary blood draw. Immature-to-total ratios are done on venous blood draws, and how well capillary blood immature-to-total ratios agrees with venous blood, it still needs to be confirmed. In our cohort of newborn infants, the immature-to-total neutrophil ratio was not affected by birth vaccination with BCG. Thus, BCG vaccination does not affect the specificity of the immature-to-total ratio as an indicator of early onset sepsis. This study has evaluated the effect of BCG vaccination on immature-to-total neutrophil ratio in healthy newborns, finding that the vaccine does not affect the specificity of the test. However, we did not assess effects of immunization on immature-to-total ratio in septic infants. What we propose in the future is to assess effects of BCG and immature-to-total ratio of septic infants to determine whether sensitivity is affected. And thank you for your attention.